So can Botox be done around the eyes? I always tell my patients when they have concerns with the under eye that Botox is excellent for taking care of the crow's feet on the sides of the eye, as well as some of the lines that come down onto your cheek. However, if your main concern are the wrinkles directly underneath your eye, Botox is not the most effective treatment for that. Usually those wrinkles are caused by your cheek coming up and kind of wrinkling that excess skin under there. And we're not going to do anything with Botox that's going to inhibit the action of your cheek, because that could affect your smile and make things look a little too frozen or too fake. So a lot of times if the wrinkles are directly under the eyes, I recommend things such as laser treatments or products to help to tighten up that skin, or even possibly some filler underneath the eye to help with plumping that skin so that there's not as much laxity or looseness, so that when you smile you don't quite get as much of that. So Botox for headaches, yes, it is actually now FDA approved for the treatment of migraines. I myself do not do treatment for migraines. I usually refer patients on to a headache specialist or someone who deals in pain management. This is for a couple different reasons. Number one, sometimes you can actually get it approved through certain insurances. If you can say that you've tried A, B, and C and it hasn't been effective for you, then they will cover migraine treatments. The second reason is that a lot of those injections are actually done through the different areas of the scalp and even back down into the neck, so I choose to leave that to the specialists in that area. However, a lot of my patients do find that if they experience regular tension headaches, just getting Botox through the glabella and forehead area a lot of times helps to relieve those headaches. And in fact, a lot of my patients tell me that they know that it's time to come back in for their Botox because they started to experience those headaches again. So do you have to keep getting Botox? Obviously, if you want those long-term effects with the Botox, then it's FDA approved to last about 3 to 4 months. So that is something that usually needs to be repeated at least twice a year. However, if you try Botox a couple times, or if for some reason you get to that point where you can no longer keep up with your Botox, things aren't going to all of a sudden get worse or even revert back to the way that they were before you started getting Botox. Eventually, of course, the aging process continues and you will see those lines starting to come back and starting to deepen again, but it usually takes quite a while and you're never going to be worse than you were before you started.